Hi, I'm Lucy Hulme, and my academic background is in psychology. So I did my undergraduate degree here at Manchester in psychology, and then also did my master's degree here as well, but a bit more specifically in health psychology. And now I'm doing my PhD, still here at Manchester, and getting really specific into an area of health psychology. I'm doing teachable moments within perinatal care.
Brilliant. Thank you very much, Lucy. So, as you said there, second year part-time PhD student here at the University of Manchester. You told us a little bit there about your topic, but please could you just tell us a little bit more about your area of research for your PhD programme?
Yep, awesome. So my research is kind of underpinned mainly by the theory of teachable moments. So what a teachable moment is in a nutshell is just it tries to explain why people spontaneously adopt risk-reducing health behaviours after specific health events. So for my research, that's going to be pregnancy, and that includes even the sort of 2 years postpartum time. So I want to look at mothers who are making changes to their exercise or their diet and have a look at why they might do that and support them with that. So pregnancy specifically is a really unique time as well because women are seeing a healthcare provider much more frequently over those kind of 2 year span than they probably will at any other point in their life. And I think that's a really great opportunity for healthcare providers to support them making these health changes, especially if women are already motivated to do so at that time period. So that's the kind of theoretical background of what I'm doing, but the actual work is a little bit more specific. So what I'm working on right now for these first 2 years is what's called a systematic review. And that's just a fancy term basically for looking at everything that's ever been written on this topic and summarising it, essentially. So what I want to look at first is quite broad. I want to look at how women experience talking with their healthcare providers about health. So I'm going to look at every paper with either GPs or midwives or health visitors, anybody, and have a look at what women essentially do and don't like about those talks. And then I'm going to put all that information in one place. So that's what I'm working on at the moment. And then I've planned a little bit for the next couple of years, but as I'm sure everyone with research knows, you can only plan so much. You've got to leave a little bit of room for flexibility because you don't know what you're going to find. So my next couple of steps will be focusing in on a very specific check that women have, which is the 6 to 8 week postnatal check. The reason I'm just going to focus on this is because I think it's a really useful check for helping women make these changes. And what I'm going to end up doing is some observational studies. So I'm going to set up a recorder and basically watch these checks and then use my previous work to kind of look at what is happening in the check and compare it to what women have already said they do and don't like. So that's kind of like the building blocks of where I'm going at the moment. And then sort of in 6 years' time, because I am part-time, so it's a long, long time from now, the main kind of end goal of all these building blocks of research is to create something that's going to help women actively in these checks. So we don't know what that's going to be yet because we've not done all the research I've just explained, but that's kind of like in a really big nutshell what I'm doing.
Brilliant. Thank you very much. Very busy 6 years ahead for you there. Can I just ask, how did you become interested in this as a topic area?
So it's a little bit funny. When I was applying for my master's, I originally had no idea what topic I wanted to specialise in. So I just kind of went for the research master's. I thought, get yourself some basic skills, you'll figure that out later. But the one thing I was really passionate about was qualitative methodologies. Like, I know that one of the bits I love most about psychology is talking to people and getting that more sort of individualised, personalised experience and kind of helping them on a more specific level than the sort of wider general population universal level. And the master's course that I applied for, about 2 weeks before it started, after I'd already got my acceptance, cut the one qualitative unit. So it was a completely numbers-based course, and as that wasn't really what I signed up for, so very last minute I switched to a health psychology master's that had been recommended to me by someone whose lab I worked in. And yeah, from there I just very luckily fell into a project with you as my supervisor, who was obviously brilliant, which was all about maternity care in COVID. And yeah, it was just, I really enjoyed talking to women. I think I learned a lot about the different elements of maternity care and how much there is to explore within it as a healthcare experience. And so after I finished my master's, when I saw this PhD come up at Manchester, I was like, it's a bit too perfect to not at least try to get on. So I would say I kind of ended up here a little bit by chance at the start, but then I was very lucky to have the pieces fall into place towards the end.
Can I ask you? You've told us a little bit about your plans for kind of moving forward. Can I ask how people might be listening to this thinking, oh, I'm really interested in this too. Either I'm pregnant or I work with pregnant women or I'm just interested in the topic area. Can they get involved at all in the work that you're doing?
Yeah, definitely. So I think in terms of like involvement in this project, there's going to be kind of two main avenues to do so. So you kind of already mentioned one, which is if you're currently pregnant, there might be a chance that the stars align and your postnatal check will be happening around the time that I'm looking at postnatal checks. This is probably going to be in the next couple of years, so anyone who's pregnant now, I'm afraid that probably won't be the case. But I will probably be recruiting in a couple of years for people who would be happy sharing their postnatal checks in this. That would definitely be one way specifically for women having children at that time. But obviously that's going to be quite a minority of people in that specific moment. So another way to get involved that's definitely open to more people will be a patient and public involvement group. So me and some other researchers who are also looking at pregnancy and pregnancy healthcare are putting together a group, and it's going to include women who are currently pregnant, women who are postpartum, women who are years beyond their pregnancy but still want to talk about it, and also healthcare providers. So a nice kind of well-rounded group. So even if you're not pregnant or if you're not a woman, you're more than welcome to be involved in this patient and public involvement group. And what we will probably be asking of you at that time will just be chatting to you about the way we go about data collection and asking you, do you think we're going to find things that answer the questions we're asking with the methods we've come up with? So we'll probably ask you about things like that. And also just asking you things like what we found, the way we've interpreted it as researchers, does this match your experience as an individual? So I would say the patient and public involvement group is the best way to get involved in terms of direct involvement in research. But if you're lucky enough to be having a baby in the next couple of years at the perfect time, then I would also love to hear from you then too.
Brilliant, thank you very much. So just to summarise there, two ways people can get involved with your work is one, maybe through a patient and public involvement group where you would kind of work alongside them and ask them for support and advice with your research as you're going on. And then secondly, maybe to actually take part in your research, like you say, if it all works out at the same time. And obviously ethical approval and things will need to be sought along that time as well. So if you're in the areas that maybe you've got the approval for, then that could work quite well. And the way to do that, I suppose, is to email you, isn't it? So could you mind just telling people your email address?
Oh, yeah, of course. So my email address is lucy.hulme, so that's lucy.hulme @manchester.ac.uk. If you Google my name and Manchester, it will come up straight away.
Brilliant. Thank you very much. And a final question. What do you hope to achieve at the end of this PhD?
So the main thing that I want to achieve by the end of this PhD is simply to have helped women. I want to create something, and even though we don't know what that is yet, whether it's a communication tool or a training package, we just want something that's going to support women making these health behaviour changes. Because at the end of the day, that's the point of research, is these practical outcomes for women going through pregnancy and postpartum. So my main end goal is to help women make these changes, and perinatal healthcare providers already do such an amazing job. All I want to do is kind of supplement that and help them do an even better job, because everything that I've read in the research is suggesting that this specific 6 to 8 week check is a really good time to be providing this support. So I want to help them make the most of it.
Brilliant. And actually, an aside question, aside from your work, if anyone's listening to this, either at undergraduate level or master's level, or maybe not even at university studying psychology yet, but they're thinking, oh, this sounds like the kind of, future I would like in terms of my career, what advice would you give to them?
That's a really good question. I think advice I'll give to anyone who's aspiring to any sort of research-related prospects would be just talk to people. Like, I think I got the best opportunities in my very young, early career just by talking to lecturers or talking to people who were working on projects and kind of prodding and poking and asking if there was anything I could help or anything I could read. And from there, you kind of just snowball because you get to know people. And I know that everyone says networking is like this big buzzword and it's really scary. And I was definitely one of those people, but you don't even realize you're doing it. It suddenly becomes that you know someone who knows someone who's doing a project, and suddenly you have a job. So, yeah, I would just say don't be afraid if you're ever interested in a specific project or a specific person's research. So just send them an email and tell them how much you think their research is cool. If there's one thing I know about researchers, we do like to brag about our research. So yeah, we would love the opportunity to be like, yeah, my research is great. Do you want to work on it?
And can I just add there, we also rarely get those emails. So also please do email us with those nice things.